Hello, ladies and gentlemen. Welcome to the backstory. If you're new here, kindly hit the subscribe button and the notification bell down below so that you can be notified when we post a new video. Now, ladies and gentlemen, it's so unfortunate and shameful that 60 years after independence, we can still expose some of our best professionals to a state of begging for help from Kenyans. Now, I'm talking about doctors. Doctors have been on strike for the last more than 1 week now. And instead of the government looking for ways of solving their problems, they have resorted to a very, very uncouth way of trying to force them to go back to work. But now, before we look at all that problem, remember when the Kwanza administration came into power, they promised Kenyans a very lucrative kind of universal healthcare. A healthcare that was going to take care of the health services of Kenyans, basic health services of Kenyans, and a comprehensive healthcare service for service providers like doctors. But whatever they're doing right now is contrary to what they promised. Because if you look at what they are currently doing to doctors, they have resorted to very, very uncouth ways. Before we get into that, I want us guys to listen to one of the doctors so that we can get to know what the problem is. Then we'll come back and analyze.
The most tragic thing around it that 27% of our healthcare workforce in this country are interns. Kenya is grappling with a serious shortage of healthcare workers. For example, the nurses. WHO says that 25 nurses should see 10,000 Kenyans. We have only 8 nurses seeing that number. And what does it translate to? When you have a sick patient somewhere in JTRH in Kisumu, then you'll be told, stay behind and feed your patient, stay behind and wash your patient, stay behind and give your patient drugs. So the 2 nurses are not going to run an entire ward of 70 mothers giving birth. Or when you're told that you should have doctors in 1 to 1,000 ratio, and you have 17,000, 1 to 17,000. What does it mean? Every day when you go to that hospital, you are going to choose as a mother on this child who falls sick at night. Will I go for my daily wages as a mama fua, or will I spend the whole day queuing in Kenyatta? Because you know that the moment you go, you'll have loved to lose one. So you choose to go for your wages. You come back, this baby has diarrhea and dehydrated and died when you're away. Or when you're told as a man that you have this kind of a surgical procedure, but the queue is 3 months ahead. So you have this thing complicating, but the theater space is full because you have one surgeon running an entire. Or when you have 100 oncologists, cancer doctors, serving 55 million Kenyans, 1 to 500,000. What does it mean? That yes, you have told me I have cancer. In Homa Bay, I have cervical cancer. But for me to access a doctor, I will see this doctor in 2-3 months as the cancer gets worse and my mind goes crazy. I have this disease and there's no doctor, nothing going on. Those are the realities that Kenyans have to live with every day because of a broken healthcare system. And in all this big mess, the person who has to pay that ultimate price is a doctor who has to see 200 patients in a shift, who has to see mothers dying from preventable disease, to that nurse being blamed for killing a mother giving birth. Yet they all know that we only 2 nurses in Mama Lucy when 40 women are in labor. What do you want me to do? To add to the issue around delayed salaries, landlords knocking your door on you, third-party deductions being taken away from you, KRA, unakatwa pay, they don't remit. They take away your loan, they don't remit your CRB. They take the policies for your child insurance, they don't remit policy lapses. When you give a strike notice, no, it's a calling, don't strike. This is a career, not a calling, my brother.
Now, ladies and gentlemen, that doctor has talked about is a KMPDU official, and he has lighted some of the issues that are affecting them, why they are on strike. And he's talked about their salaries, that they are being paid like the salary that should be paid to interns. And then secondly is the working environment. On 28th, which is around 2 or 3 days back, the KMPDU officials came out to ask for help from Kenyans, which is quite unfortunate. Now, KMPDU officials came out to ask for financial help from Kenyans. And in a statement which they released to media houses, KMPDU officials appealed for financial support after faulting the government for halting the remission of their union dues. Now, in that presser, and I quote what they said, the government has stopped remitting union dues to cripple our demand for a better public healthcare system. We are calling on all our friends to support us for the upcoming legal battles and Doctors' Assembly. The KMPDU officials have went further to attach an M-Pesa pay bill number, urging Kenyans to stand with the doctors in their strike. One thing that our political class is missing is the fact that healthcare should be handled wholesomely. That is the software and the hardware part of it. But now our focus as a country and what our politicians are doing is focusing on the hardware, whereby they build very, very good houses in terms of infrastructure. They do very good buildings in the name of hospitals. But when it comes to software now, looking at the interest of doctors, having medicine in hospitals, doctors having gloves, the basics of healthcare, we miss that point. That is where the problem is. Because you see so many governors doing very good infrastructure, very good hospitals, very good houses in terms of hospitals. But when it comes to medication, if you go to some of these hospitals, guys are sharing beds, literally sharing beds. Go to those public wards, not the private ones, public wards, even in level 4 hospitals, referral hospitals. That is the situation. So however much the political class are trying to blame the doctors, but we have to go back to the basics. Get the software right, remunerate doctors right, give them a conducive environment for working. Because one of the things that we also need to know is the fact that if doctors are not remunerated well, they will not attend to their patients. And who are their patients? We as the common Kenyans. We are the ones who are their patients. So they will not attend to us. They'll go out looking for other opportunities out there. Then secondly, the political class has also forgotten about the professionals in every sector of the society. If we were serious, as the Kwanza administration is talking about doing an overhaul of the healthcare system, then the money that they are going to use to pay cabinet CASs, that money should have been diverted to work on the healthcare system of Kenyans. That money should have been diverted to pay doctors, to employ more interns. Of course, what are these cabinet assistants going to do? We have undersecretaries in ministries. These are professionals who understand the nitty-gritties of these ministries. These are the guys who should be given the responsibility to run those ministries, not political appointees who have no kind of expertise in the various ministries that they are going to be posted to. So instead of using that money to go and employ political appointees, then that money should have been diverted to pay doctors to sort out issues that are affecting the healthcare system. And I think the Kenya Kwanza administration, up to now, I think they have failed in governance. It's like they're so much focused on people loving them instead of making things work for Kenyans, creating a conducive environment where Kenyans can do business, Kenyans can do their jobs. And then secondly, letting professionals enjoy working in different spaces that they work in. Some of the key issues is still healthcare, the fertilizer, which I talked about in the previous videos. I talked about economic sabotage by the Kenya Kwanza administration. Because when you give out fake fertilizers, what happens? The same thing to healthcare. If you cannot pay doctors and then they go on strike and they are unable to treat Kenyans, they are unable to attend to Kenyans, what happens? We have a collapse system. And as they say, a healthy nation is as healthy as the citizens themselves. So when the citizens are not healthy, then we have a collapsing kind of nation. So those are issues that the Kenya Kwanza administration need to attend to and they need to think about. So ladies and gentlemen, I think Kenyans need to come out and speak up about some of these issues, because the people who are affected mostly are the common men or the common man as we call them, the common mwananchi. When healthcare system collapses, where the people who are going to suffer most, because some of these politicians, they have comprehensive covers that they're given by the government. Then when it comes to food security, a government that gives out fake fertilizers or that allows people to sell fake fertilizers to farmers, it means that in the next 3 or 4 months, we're not going to have bumper harvest. When we don't have bumper harvest, what happens? There is food insecurity. We'll start importing. We're relying on other people to feed our nation instead of relying on ourselves to feed ourselves. So, ladies and gentlemen, those are issues that we should talk about as a people and then try and fix them as a country. And it's a call to also the Kenya Kwanza administration to try and fix some key issues that are affecting this nation instead of playing politics. So, ladies and gentlemen, that is it from us today. We'll keep monitoring what is happening in the political cycles and keep you posted. But if you're new here, kindly hit the subscribe button and the notification bell down below so that you can be notified when we post a new video. Until next time, bye-bye.